Now, having said this, I think it is important to understand why, despite a statement as early as the 3rd of January, that that Malaysia was well placed to respond to the crisis, what happened and what failed. And I think it's very important for us to have an all-of-government approach in terms of looking at responsibility for this. Why did we not respond much more effectively? How is it that almost in all of East Asia, except in Wuhan city and and the three surrounding provinces, there was no stay-in-shelter lockdown? There has not been a stay-in-shelter lockdown in the Republic of Korea, for example, or in any of the other countries. There have been stay-in-shelter lockdowns in very, very targeted areas. For example, in Hanoi, there has been a so-called commune, which is basically something like a section in Petaling Jaya, where you've had a stay-in-shelter lockdown. But you've not had national stay-in-shelter lockdowns, but you have had a number of precautionary measures, public health measures, which have been very, very important in terms of containing the contagion and in terms of mitigating the pandemic. Now, I think it is also important for us to recognize that as early as the 10th of February, the Economic Action Council, I had the honor of being a member. I must confess that I had zero impact on economic policy during the 22 months of the Pakatan Harapan government. But finally, at the last meeting, I managed to get additional funding, and thankfully the Prime Minister at that time accepted the need, and the current Prime Minister was also at that meeting. So they all realized, I think, that there was an attempt at a response in terms of providing significant additional fund allocations to dealing with COVID-19 as early as the 10th of February. Now, of course, we also know that for want of a better term, the coup which took place in late February was quite disruptive in terms of organized governmental response. I don't think it is fair and correct to blame MOH officials, for example, for this, as some people want to do. Now, moving on very quickly, I think it is the initial government response in terms of Prihatin and later Penjana were actually reasonable. I think it was reasonable that there were such measures. I think they were unfortunately too imitative of what was going on in the West in terms of the nature of those packages. So as a consequence of this, three particular groups which are very important in Malaysia in terms of understanding the spread of the epidemic in Malaysia were largely unhelped. Not completely, but largely. The first, I think, to recognize is the role of what are called daily rated workers. People who basically, if you don't work, you don't get paid. And there are still millions of such people in Malaysia. It's very important to recognize that that is not a phenomenon of the past. We still live with that phenomenon. And for them, there was no real relief because of the nature of their contracts. Many of them have what are called contracts for labor rather than contracts of labor. And so the responsibility of the employer with regards to them is very, very low. And they do not appear anywhere in terms of the usual contract roles. You might see some of them occasionally when they are lining up to collect their bi-weekly salaries and so on and so forth, and often to pay off their alongs to whom they are indebted. These people were not particularly helped. Another very major group are the petty businesses. The petty businesses, which are very common in Malaysia, and many people who are essentially self-employed, running businesses at the family level. They are not in the category of so-called small and medium enterprises, which were also adversely affected, but we can come back to that later.